My name's Bassett, and I won the PBS UK Student NHS England Award thing, which is very nice. I feel a little bit like a fraud because I started this before as a student, but I'm a student now, so I kind of nicked in there and managed to get it, which is really lovely honour, really nice. But I'm here to talk to you a little bit about the project that I started at Norfolk County Council and where that's gone and how it's expanded and generated. And I kind of wanted this to be, I didn't want it all to be theory and saying, oh, look how wonderful this is. I wanted it to be more practical for people who are potentially trying to implement this within their own organisation and perhaps feeling a little bit isolated or like they're just shouting into darkness and no one's answering back. Because I've been there, and I wanted to give some practical advice about how you manage that and how you get a large organisation or a small organisation to get on board with your idea. So, tiny bit about me. So currently I'm Norfolk County Council's Partnership Board Transformation Manager, which is a title that means nothing to no one. But essentially I work with people with learning disabilities and people with autism on partnership boards to build them up and through co-production and garner views and things like that. Previously, I was the Autism Learning Disability Consultant, and that's where this project came under me. I'm a trained teacher. Most of my career has been spent in education, and then I moved into the consultancy position for Norfolk County Council, trained SENCo, and I'm currently a master's student of applied behavioural analysis and positive behavioural support at the Tizard Centre. So quite a few of the speakers you see today are the lecturers that I go to. So really fantastic speakers. But my whole career has focused around additional needs and working with people who have those needs. So how did the journey of Norfolk begin? So it was my second week at the county council. I just moved 170 miles to Norfolk, so I knew no one and nothing, into adult social care, which I hadn't worked in before. And I met up with one of the lead commissioners, and she, very, very busy woman, very pleasant woman. We had a really quick chat, and she part-funded my position, and she left me with the words of, do something with PBS. So I didn't know what that meant. I didn't know what PBS was, but I said, okay, of course I will, and went off and started learning a bit about it. Subsequently, that commissioner left after about a month, and so I was just stranded by myself with this do something with PBS, and needed to build something out of it. So I started learning. I had to look at different courses online, what the available research, and then convinced my line manager to send me onto one of the coaches courses. I'm not endorsing any sort of trainers or build course. And it was a really intense course. It was 8:30 a.m. to 7 p.m. for 3 days. It was in Bristol when I was in Norfolk, so it was dedication there. And when I started to learn about it, it was a bit like an epiphany. So throughout my whole career in education, what I wanted to do was understand why people were doing the things they were doing, opposed to punishing them for doing the things they were doing. And I went on this course, and I was like, I was justified in the things I was doing. So teaching people how to self-regulate, how to use mindfulness and deep breathing, and explain the rationale behind their behavior, all the reasons that teachers didn't want to send their students to me because I wouldn't tell them off. I would sit them down and talk it out with them. And I finally felt justified that I was doing the right thing, and it did have scientific basis for why I was doing those things. I'd always just done them because I thought they were right, but it was nice to have that scientific backing to it. So one of the things that always springs to my mind with this is when I was at SENCo, there was quite a tough year, and I'd regularly be sent the students from classes. And there was one young man who, on this occasion, he'd screwed his work up and torn it asunder, and then he was sent to me for a good old ear bashing. And as in my normal manner, I sat him down and said what was happening, what was wrong. And it came to like it was too hard for him, and the best way was to escape that was to destroy it and get rid of it. So we talked through all of that, and we got him back to baseline, to being calm and being rational. And I said, what's the next steps? And he said, I've probably upset the teacher because she spent a lot of time making that for me, and I need to go and apologize. And I said, brilliant, really, really well done. So he'd gone through this in his brain and understood the implications of his behavior, brought him back to the teacher and said, he's got something to say to you. And he said, I'm really, really sorry for what I did. And she said, I do not accept your apology. And that's always stuck in my mind, that punishment is so ingrained in some institutions. And I doubted myself so many times that I should be, I should just be punishing these children. Like the behavior policy said, they should go through all these things, and then, progressively more horrible things happen to them. But it was an epiphany. And that belief pushed me forward to carry on trying to convince people that this is something that we needed to do. Within that training, we learned about Kotter's 8-step change framework. And this was about how to, a part of that course is about how to lead on PBS and implement it within your setting, your organization. And I actually based what I did around this framework. And I loosely base everything else I've done around this framework as well, because I found it very useful. So I've broken it down into, we've only really up to stage 5 at the moment, even though it's taken a couple of years. So for PBS, I needed to create a sense of urgency. I needed people to understand that we needed this right now. And that wasn't difficult because the evidence was glaringly obvious, let alone transforming care, which at the time was still happening. We have things like STOMP, the Restraint Reduction Network, along with all of those legislative pieces, a lot of them by Norman Lamb, who lives in Norfolk, that are saying you need to be less restrictive, you need to find proactive ways of supporting individuals. The LEADER reports, the serious case reviews, and then just ridiculous things like constipation campaigns where people are dying of constipation because people do not recognize their way of communicating. Their behavior is showing that they're in pain, and then they die of impacted feces, which should never be happening. So evidence was there, it wasn't a hard sell. Stage 2 was to build a core guiding coalition. So I essentially just kept turning up to meetings and then saying to people, oh, can you invite me to a meeting? A lot of them were rubbish, but I slowly started to gain this network of people that had influence and understood it. And there was a lot of people who already wanted this. It just needed someone to collate them. So working with the CCGs, NHS Trust, so in particular, the LD, the learning disability, and behavioural services, where they were already doing this. They were already using PBS, but they were a reactive service. They were the ones that you went to when things have really gone bad. And there was no point to that because we were using a proactive strategy as a reactive strategy. The commissioners, I was very, very fortunate that a new commissioner started at Norfolk County Council, and she got on board with this and then really, really backed it. So that was one of my strongest allies. The providers within across the Norfolk, our people who uses, we have our learning disability partnership and our autism partnership, and garnering their views and their understanding and what they wanted. The advocacy groups, excuse me, I just had a chocolate to give me a boost of energy and that stuck in my throat. So having their views, what happened to them, and there were some really powerful stories that I could take back to these other people and say, do you realize this has happened to this person? The charities and volunteer sector, and also things like administrators. I had an incredible administrator working with me who, when I told her about this, she just wanted to learn more, and she was so engaged and she was so fanatical about supporting me with this that she was proactive in how she supported me. It wasn't just another job, it was something she really wanted to get involved in. And then other organizations branching out, people like Skills for Care, who were able to show me good examples and lead me to other people across the country who had done similar things, which I learned and factored into my own plans. Number 4, enlist a volunteer army. So I had a plan, I knew what I wanted to do, but equally that wasn't really good enough because that was just me learning about lots and lots of things and then deciding this was our way forward. So I wanted to co-produce a plan for how Norfolk as a whole went forward. It's not only just to make sure that the plan had more fidelity, but also that there was self-efficacy in there, that people had put themselves into it, and because they made that plan, it was owned by them and they would want to do it, opposed to being told by the council, you're doing this now. So we had an open invite, we sent it as far and wide as we could, and we expected about 15 to 30 people. So this is a really, really important lesson for everyone. Never underestimate the power of a free lunch. So we had about 130 people sign up and around 90 of them turned up to the event. So these were just some of the organisations that came. We got all the trusts there. We got odd ones, good ones, but odd ones like the Department for Work and Pensions, the CQC, lots and lots of voluntary sector and social enterprises coming along as well. And all these people, self-advocates, experts by experience, whole advocacy services come along and input and say what was important to them. And we took all of that information and started to turn it into a PBS plan for Norfolk. So we had our plan. It was further co-produced. About 40 of those people signed up to carry on working on that plan, and we came up with what we're calling Norfolk Positive Lives. So the next stage was to enable people by removing barriers, and through that work we started to identify the different barriers from different services and sectors. So one of them was resources, documentation, CPD, guidance and help. So we started to put things into place like PBS steering group to collate different documents for good examples and having a central place to put them so people could access them. So we started to have consistency across our documentation. That's still a work in progress, that one at the moment. Like I say, we're at number 5. A PBS network for continuous CPD, continuous professional development, because it's not good enough to just train people and then dump them back in their services and say, right, it's your responsibility now, because that's never going to work. So people need to be able to air, to be able to talk about what's working well, what's not, share good practice, and get a deeper understanding as well. The next one, sorry, commitment. So why should people do it this way? We learned from good examples, and we learned from examples that hadn't worked too well. So we knew of one county council who had gathered together a load of money, said, we've got all this free PBS training, it's wonderful, it's going to, improve the quality of life. And they couldn't get any providers to sign up because providers didn't want to release their staff for training they didn't see as necessarily mandatory or required. And a lot of this training was really pushed, and some of it went to waste. Very, very expensive, very high quality training, but they couldn't get people to go on it. So the Norfolk Positive Lives will become part of our contractual obligations across these supported living and residential providers. So a little bit, it's not very PBS-y, but it's the carrot and the stick. Here's all this wonderful free training, but you need to do it, otherwise we won't be employing you. And learning from those really good examples like Greater Manchester and Brighton, Essex has its own PBS service. And the last one was training, and it was about systemic training. So not just 3 members of staff and saying, you're our PBS people now, and we'll plop you, when there's something wrong, we'll plop you in and you'll fix it with PBS. It's about having the policymakers change their policies so that there isn't any obstruction within that setting, and having the practice in line with that, so that there aren't barriers for that good practice to hit, and then people just give up because what's the point? The organisation's not behind you. So we've done that across both our across our providers, what we're offering them, but as well within NCC, so we know what we're talking about, so people know what to look for and can put the right contracts in place and commission properly looking at PBS. Further to this, we have, I'm just looking at my notes, so we've got all sorts of levels of training that we've put together. So foundation, functional assessment, senior leader training, coaches, practice leads. As well as that, we've got 4 master's students at the Tizard Centre learning ABA and PBS. So we've got that higher level that can not only offer continual professional development, but can also go in and support those services that might be having difficulties, and the coaches as well, because it can't just stop at the coach. They need someone to go on to support them as well. So in the end, it all boils down to money. But another good bit of advice, a pro tip, is the phrase spend to save, or cost saving benefits. So if you're going to talk to someone about quality of life, everyone immediately goes, yes, of course we should be doing that. When you say it's going to cost money, they say, well, we can't really afford it. If you can evidence that putting this into place is going to save money in the long run, then some people, because that's their job and they need to justify it to their bosses, they can support you better. So I did a really small exercise where I looked at the amount of people in residential and supported living. I took an example of 25 of them. I think there's 1,400 or so or more across Norfolk, and said, if these 25 people don't escalate, not that they come down, but they don't escalate their need, we can save more than we spend in a year. And that was very appealing. And then it worked out to be something like 7 million across however many years. So that was really, really appealing. That helped people to get on board. So I removed that barrier for them. And it's also about knowing your audience. Like I said, quality of life will work for some people. It works for most people, but you've also got to support those people who are looking after the pennies, because there's a finite amount of resource, and you have to show that your project is going to benefit the most people for the best cost.
Just your 10-minute warning.
Okay, lovely, thank you. So how did we get this money together? I managed to convince enough people within NCC to commit money to ongoing employment for someone to run this out, as well as start to pull money together to pay for training for providers for free and within NCC itself. And then we went to other bodies. We weren't always successful, but for example, the STP got on board with the project, and they gave a sum of money to support that project and to help with the rollout of it. And we're also putting safeguards in. So as much as we want to remove all the barriers for people, they also have to play their part. So if you sign 2 people up to a course and they don't show up, we are going to be asking for that money back, because we're working together. You can't just take. You have to, it has to have reciprocity. So the impact so far, I'm almost done. So providers starting to change their approach. They're aware this is coming, and they'll say to commissioners, oh, we're doing this about PBS, unprompted, because they know that we want that change. It's spurred other health colleagues on. So one of the local trusts, they've commissioned a bespoke package from the Tizard Centre, and they're training 40 of their community clinicians in positive behavioural support. Further, a whole PBS support service is now being commissioned because of this work, where it started from, to further support its implementation. Contractual obligations are going to be changing, and NCC are preparing to train 428 staff members across residential and within NCC in PBS and all those different levels that I outlined earlier. We're starting to organise our network with our master's students and the coaches who are trained up, and in fact most other people who want to can come along to them and share good practice and have some professional development. And as I mentioned earlier, the steering group will be set up to consolidate good examples of documentation and make them publicly available for consistency. So what's next? We need to show that it works. I still, even though this has quite a large budget to it and it's taken a long time to set up, I still see this as a pilot project. But we have so many other areas that could benefit from this, like day service and respite. And again, this is only adult. We need to get into children's, we need to get into schools. If we're going to do a proactive preventative approach, it's no good just doing it with adults. We need to get down to the base level to stop them from ever requiring that level of support. I want to say to both qualitative and quantitative. So ABA loves data, it's a science, everything is measured, but we need to do the same. But the quantitative can only take you so far. You can measure the reduction restraints and PRN use and turnover of staff and things like that, but it's the stories that make the big impact, and that's where your qualitative data comes in. And hopefully the evidence from that will lead to bigger and better things in the future, and we'll get more of the sectors on board to show that this works with a really complex, vulnerable group of people. If we expand this, then we can help improve the quality of life of even more people. There you go.